Hello, everyone, and welcome to our latest online event here at the University of California, Merced. My name is Ricky Hill, and I am your e-recruiter back with you again for another live virtual event. We are always so excited to have you here with us, taking some time out of your evening. And tonight's special event, as you see on your screen, is going to be all about medical education and the pre-health program at UC Merced. So again, another big welcome to you tonight. And so thank you so much for joining. Before we get started, of course, I have a couple of quick Zoom reminders. If you need to adjust your audio settings at any time, you can do that in the lower left corner of your screen. If at any time you'd like to zoom into something that we are showing you on your screen, go ahead and click on View Options. You should see that in the upper portion of your window. Of course, we would love to get to all of your questions tonight. And you guessed it, we are fully staffed behind the scenes with our content experts. They're ready to get to those questions, so go ahead and use the Q&A button that you see on your screen. Click that button, send in your question, and they will get to those throughout the next hour. Now, of course, we always like to save some of those questions for the end so we can have that live question and answer session as well. So don't forget, send those in, but throughout the event, you can send those in at any time, and we will save some time at the end as well. So once again, we always record these events, so we want to make sure that you are aware of that. Also, keep your chat window open because we will be sending you links throughout the presentation. That way you can save and bookmark those websites for later on. One of those will be the events page. So make sure that you do keep that box open, save those, and you will be able to get to this on-demand instant replay in just a couple of days. Now, we also have a quick poll question. I would love to get this information from you tonight. Where are you located this evening? What city are you currently hanging out in while you join us for this live virtual event? So we'll go ahead and give everyone a couple of seconds here. We have quite a turnout. I'm just glancing over it at the attendee list. So again, we'll give you another second or two here. And once again, a big welcome to this medical education program tonight, talking all about pre-health at UC Merced. Go ahead and sit back and relax. We're going to dive right into this presentation right now. My name is Ricky Hill, your e-recruiter. At this time, I would love to pass this over to our main presenter tonight, Dr. Venner.
Hi there. My name is Dr. Margot Venner. It is great to see everyone, even remotely, in a webinar format tonight. I am so excited to be here. The reason I'm so excited to be here is because we desperately need more healthcare professionals in California and particularly in the San Joaquin Valley. And you all are the faces of the future healthcare professionals that will take care of our state and our state's population for years to come, including me when I'm old. So I'm very, very motivated to make sure we're doing a great job in explaining to you what your options are tonight if you're interested in a health career. I'll share a little bit about my background, which is I'm a family doctor. I worked, or actually still work, at UC San Francisco in the School of Medicine. I've been there for like over 2 decades, working in the refugee clinic in San Francisco. And then about almost 3 years ago, I got my dream job, which was to come be part of medical education at UC Merced and really help create a pathway of future healthcare professionals in the San Joaquin Valley. And I say that's my dream job because it is. Working with young people is incredibly exciting, inspiring, and seeing the dedication and the commitment to serving your community, to working with people who need health care, to learning, to being part of research is truly inspirational. So it is absolutely an honor to be here today. I'm going to go ahead and explain why UC Merced is a fantastic place to be a pre-health student. I have so many reasons. I put some into PowerPoint, but I'm betting that you will have lots of questions that I never thought of. It's the first time I've ever done a webinar like this. As you can see, I pretty much mostly do patient care. So please vigorously use the Q&A section to ask all of your questions. We've got a team of folks to answer. We'll answer, as Ricky said, we'll answer some of them digitally right now and some of them online at the end. We can answer live. So with that, no further ado, I'm going to, let's see, try to use this correctly and get my screen to forward. There we go. So why UC Merced for a pre-health career? all of you right now, presumably or probably most of you are in your senior year of high school, and you're asking yourself, okay, I've worked really hard. I've applied to a bunch of colleges. Maybe I have different options of what my next step might be. Why should I go to UC Merced if I'm thinking about a health career? Um, and before we even dive in any further, I'm just going to say I have a lot of experience working in a lot of different places and institutions, and the reason that UC Merced stands out is very simple. It's the people, the people, the people. There is an incredibly supportive community of educators, of staff, of students at UC Merced, and probably every school says that, but at UC Merced, it's really palpable. When you walk onto campus, there's just so many people there to support you. It's not as big as the other UC schools. That just means a lot more personal attention, but it's got an incredible research mission. We just became an R1 research school, so very top-notch in research. It's absolutely a hidden gem in California, and we hope you will join us for pre-health. So why you heard me mention that there's a shortage of healthcare professionals in the San Joaquin Valley and actually in a lot of other places in California as well, but the shortage is being felt the most acutely in the San Joaquin Valley. Why is that? And the answer is that the San Joaquin Valley has not traditionally had a medical school. We're working on changing that by bringing medical education to the valley. But also the physicians that we do have in the valley are there's not enough of them, and they're getting older, like me, like all of us actually, and they would like to retire. So we need a new wave of health professionals, not just to meet the needs of the retiring physicians, but also to extend beyond that, so we can get healthcare into communities where there's a real shortage. So it's absolutely a place where you can make a real difference. And for anyone who's ever practiced medicine, or for that matter, anyone who's ever been to a doctor or any healthcare setting, a hospital, a clinic, you realize that a doctor alone really can't do that much in the way of healthcare. We can do something, but we can't do that much. Healthcare relies on teams. So we need doctors and nurses and physical therapists and occupational therapists and therapists and optometrists and podiatrists and researchers and epidemiologists. We need everything in the Valley and throughout California to really take good care of our population and keep everyone healthy. So, okay, I think I'm interested in healthcare. How is UC Merced going to get me there? So I just sort of broke things down into a few categories: classes, mentorship, events, and supporting your application, that are all really important components of what you'll need on your healthcare journey to help you move through the entire trajectory. So I broke it down, and just to make it easy, I broke it down into 3 steps. The first step that we're going to talk about on a healthcare journey is just exploring healthcare careers. How do I know that healthcare is the right field for me? When you think about it and you ask students, people say, well, I went with my grandma to the doctor, or maybe I had an experience being ill myself, or a family member was ill. There's also a lot of doctor stuff in the media that you can see. All of that's good. It's all important. But it doesn't really take the place of getting into a healthcare system and seeing what it's all about, if it's the right fit for you. And so the first step is really exploring. There's so many ways to be a different healthcare professional. Which one is right for me? You've worked so hard to get to where you are. You've got tons of choices. And so in that exploring step, we try to help you get the information that you need and then start the reflection process to figure out what might be the best fit. So the first step on the exploring process is really getting to know our pre-health team. So we have faculty, and we have staff, and we have advisors who really help you find your cohort, your group of pre-health classmates, help you learn more about what the different careers are like. We bring speakers to campus so you can hear more about what does a nurse do all day, what does an optometrist do all day, what does a dentist do all day. So we also have fantastic advising. We have a lot of information about courses. We have a listserv that gives a lot of communications, let you know when there's different events, including Public Health Week, which is coming up soon, and speakers and activities, and really helps you stay connected in the community really from the get-go. And so I think that that's a great way to get started. But an opportunity that I will say is absolutely unique to UC Merced is the incredible opportunity to work in very small groups with healthcare professionals, so physicians and psychologists and nurse practitioners and social workers, who serve as your mentor throughout your first year or longer. If you want to stay connected all 4 years, that's great. They love it. To really help you get some advising from healthcare professionals who are already in practice. When you talk to students at UC Merced who are interested in healthcare, you ask them, like, what are you interested? What are you thinking about? And one of the first things the students almost always bring up is like, well, I'm interested in healthcare, but nobody in my family is a healthcare professional, or nobody in my family is a doctor. That's also, by the way, true for me. Um, and we want you to have role models in those fields. So we organized a course called Introduction to Medical Learning. There's a course that actually runs through to teach you about different aspects of healthcare, including communication and professionalism, and study habits and all that stuff. But also as part of that course, you get mentors. Again, you get mentors who are health professionals to work with a small group of students, like 4 students, and really get to know you through the year so they can be your mentors. And at the end of the year, what I really want everyone to say is, yes, I do know a health professional. I know someone I can ask my questions to. Actually, I want you to be able to say at the beginning of the year. Nobody should say, I don't have a mentor in healthcare by the end of the year. And again, this is an absolutely unique feature of UC Merced. I keep getting emails from other universities that shall remain nameless about that they are jealous of this program. We have some amazing mentors who are just so passionate about the future of healthcare and working with you. Another really unique mentoring feature that we have at UC Merced, also not something that you're going to find in other places, is called Prime Time. Prime refers to program in medical education. These are medical students from the San Joaquin Valley who are there to help mission and empower students who are in pre-health trajectories, to help you find what's your best fit, to walk you through, oh yeah, I had that problem. Oh my gosh, I took organic chemistry. It was exciting, or it was difficult, or I used this study technique, or did that. And really help you prepare to become incredible, in this case, physicians or healthcare professionals in any field. And they work with you all the way from the beginning about when you're thinking about healthcare all the way through to the end in the application process. What do I use to study for the MCAT? What do I do on an interview? Things like that. And this program has won a lot of recognition throughout the state for its excellent commitment, from the medical students to connecting with you, college students, in some great mentoring and role modeling experiences. So 2 incredible types of mentoring and role modeling. Nothing would be complete without adding some pictures. That's Dr. Yvonne Gomez in the back there, a longtime colleague and friend of mine, and some of our other mentors and trainees working together in mentoring sessions. And they're really here to support you as students. A lot of this work is done online because it makes it easier for scheduling, but there are some opportunities for in-person events too. This is another colleague of ours. This is Dr. Elizabeth Black. She's a pediatrician and she runs our mentoring program and is doing a really fabulous job. So when I said the step 1 was really exploring, it's really up to you to get information, experience, then ask yourself, do I really want to do this? Like, why am I interested in healthcare? There are a lot of easier careers out there. And just so I know, what are some different healthcare fields? Because as I mentioned before, there's a lot of different ways to take care of patients, to think about clinical problems, to think about research, to make a difference. I should know, what do different health professionals do? I couldn't give this talk today without putting in a little plug for explorehealthcareers.org. It's a non-commercial website that's really designed to help young people like you learn about different careers. You can go in there and search, like, what does a physician's assistant do every day? What are their hours like? What are their responsibilities like? How long do they train for? What's their salary? What's the job market like? I would really encourage you to take a look at that, because it's really up to you to think about, this is my life. It's important to know, like, what the world thinks I should do and what the outside voices are saying. But at the end of the day, it's me that's going to have this career. And so I have to ask myself, what do I like to do each day? Do I want to talk to people? Do I want to work with my hands? Do I want to look at data sets? Do I want to be outdoors? And ask yourself, what do I want to be doing 1 year after college, 5 years, 10 years? Am I thinking of having a family? How does that fit in? Do I need to be near my community? Are there special things that I'm interested in? So this is your opportunity to think those things through, talk about them with your mentor, and learn about different healthcare careers. I couldn't resist the opportunity just to put out there just how many healthcare careers are. This is absolutely not all of the healthcare careers. This is how many healthcare careers I could put on here before the slides started to get unreadable. Otherwise, we would have kept going and going and going. You can see tons of different options, psychology, radiology tech, podiatry, osteopathic doctor, midwife. There are just so many. And you really have worked so hard to get where you are. You need to learn about what are the best choices for me because I'm unique, my career is unique. And then as part of that planning, you also need to think about how many years after I graduate from college will I be training in this job? And you can see there's a wide variety on here from like a physician where you go to 4 years of med school and then 3 to 8 years of residency, or if you include fellowship in there, it's a long haul, to things that are a little shorter. You could get a master's in health administration. You could be a licensed clinical social worker. So it's important to know how many years, what kind of activity, is there any way to shorten or lengthen that path? What's right for me? So, everything from pharmacist to researcher, UC Merced will really, really set you up to think about what's the right path and get you launched in the right direction. And so then you wonder like, well, how does that really work? So when you're thinking about UC Merced or really any college, you're also going to think about what major you might be in. And then what are my career goals and what kind of courses do I need to get where I want to be? I just put this slide up because I love seeing the friendly faces of Bobcat Advising. Bobcat Advising is an entire group of advisors whose job is just to help first-year students before you transition over to having a major in your major advising. So they're really here to help. They love working with first-year students. Actually, they love working with all students, but especially first years. And we know that first year can be a challenge. So really, they are there to help you get started. So step 2, we've gone from exploring to doing. So what will I be doing in order to move forward into a healthcare career? So there's a bunch of things. When you first think about pre-health, almost everybody asks about the classes, like, what do I need to major on? What are the classes? How many, a lot of people ask, like, what grades do I have to get? And thinking about the courses is important. It is absolutely part of college to know what the requirements are. I just put up here, this is just a typical schedule or not schedule, excuse me. This is the typical requirements for medical school. Again, I put this up here only because medical school is the thing I'm most familiar with, but again, you might be interested in a different health pathway. What's important is that you work with the advisors up front to map out what do I need to take to get started. And one of the questions that comes up a lot is, gosh, well, I took math in high school, but honestly, like my math teacher was out on a health leave. And so some other teacher, we had a different teacher substituting and the class wasn't really that rigorous. Or maybe, if we go back to the pandemic, some of this was on Zoom. It's a little further behind us now, thankfully. But maybe my high school didn't leave me that well prepared for all these hard classes. So one of the things that our Bobcat and major advisors are fantastic about doing is really helping you. You'll have an opportunity at Merced to take a placement exam late this spring. I cannot urge you strongly enough to take the placement exam. Figure out what level you need to be in, because wherever you are starting, I can guarantee you that UC Merced has a course to help you get there. So we have Summer Edge over the summer to help students bump up their academics a little bit before they start. Or you could take a preparation course, like maybe if you're not ready to take calculus just yet, you could take a pre-calculus class and then go into calculus. We know that some students start college ready to launch, into hard classes right away. And some students, maybe didn't have the greatest high school experience, or maybe they did, and they just want a little bit more reassurance, but need to take a few extra classes to get there, and then they're ready to fly. We want to help you be in the best position possible. Our advisors are amazing at this. And again, lots of opportunities to ramp into classes. And I also think that that's a really unique feature of UC Merced, is just how well prepared we are to help you in that. One last thing while we're on the slide, I will point out, you're noticing a lot of these are science classes, and that's great. I will say that one of the questions I always get is, do I have to be a biology major to go to med school or to nursing school? I just want to point out that I was an English major. I had zero intent of going to med school when I was in college. I loved reading books. English was like the perfect major for me. It wasn't until that I was just about to graduate when I started thinking about healthcare. I was interested in helping people. I wanted to do something hands-on. I always thought I'd be a teacher, but um, in the end, healthcare seemed like a better fit. So I actually went back after I graduated, took all of my pre-med classes in one very hectic year, and have been in medicine ever since. If you are thinking, gosh, is it possible to major in something else and still take pre-health classes for whatever field? The answer is it may very well be possible, but it just takes some advanced planning. So again, another push to go talk to the fantastic UC Merced advisors. I promise you, they've seen everything. They're ready to help you. So back to academics, another great feature of UC Merced is that it's not just we have great teachers and small classes, which we do. It's also that we're really designed to help students make the most of those classes with a lot of academic support. So we have, most schools have office hour, but we really have abundant tutoring and peer tutoring and drop-in hours and preparation classes. So the opportunities for academic support are big because, if I'm going to be honest, your grades do matter in taking the preparation classes. And so you really want to put your best foot forward in this. It's really important to plan your classes well and do as best as you can the very first time. Other things that we have this is the section on doing. So classes are a big part of the doing, but other really big parts of the pre-healthcare activities are being involved in clubs, of which you can see we have lots and lots, opportunities to volunteer, opportunities to really engage in a lot of exciting ways that you see Merced, and there's really just quite an abundance of activities here. Other things that we have opportunities to attend pre-health conferences. My favorite is the one that we just did recently in partnership with UCSF Fresno. Remember that UCSF School of Medicine, UCSF Fresno, and UC Merced are a 3-campus community when it comes to the healthcare pipeline in the Valley. We all work together. I think I mentioned before, I still work for UCSF. Oh, look, I still even have it on my name tag. I'm there like one day a week, and I'm at Merced the rest of the time. It's really a partnership, and part of that partnership, the third arm in that, besides UC Merced, UCSF, is UCSF Fresno, where we have a lot of clinicians and residencies. So we just had a really exciting reaching out to aspiring doctors conference there. The Road conference students went to and were really enthusiastic. Other opportunities for getting involved are experiential learning. So spending time in a healthcare setting as a volunteer or volunteering in the community. We have the Margot Sousa Center for Leadership and Community Engagement, which is a great way to get involved. Also, one of the questions I get from students a lot is like, how do I get enough volunteer time? And my answer to that is almost always, think about what you really need to get out of that experience. So it's not just I need to check hours. Most health careers will ask you to have a certain number of volunteer hours when you apply. And, I always say to students, just volunteering in sort of a passive role that might be helpful for you. It's definitely a first step to see how healthcare system works. Like, do I want to be part of this? Does this feel like the right fit for me? Because, I think you may think, oh, it'll be so exciting. I've seen lots of media about healthcare. When you go there in person, it might be the right fit for you. It might not. Sometimes patients are really feeling great, but sometimes, unfortunately, people are not feeling well and people are scared or in pain. And, you've got to see if that's something that you really feel like you want to have as part of your future, see if it's the right fit. So volunteering will let you figure out, is healthcare the right fit for me? But it may not give you the extra depth that you need to dive a little deeper and go, is this what I really want to do? So we always recommend, or I always do, that you go beyond volunteering, where you're just sort of a fly on the wall, just shadowing, like, oh my gosh, I'm in the emergency department. Like, let me just stand here for a few hours and hope I don't get in anybody's way. I'll just see if I can stand far back. To something where you can be committed longitudinally over an entire year, get to know the roles, have a deeper level of activity, have more responsibilities. So that could be for volunteering, but for a lot of people, honestly, volunteering is not really sufficient because it's hard to get those deeper level of responsibilities. And health schools know that. So they virtually always look more favorably upon people who have actually had an opportunity to work in a healthcare setting. So that might be over the summer. It could be during a gap year. What UC Merced does that's really great is we have a terrific some programs through UC Merced Extension to help our students get trained up to be a medical assistant or a scribe. A lot of people will work as EMTs in order to earn some money, which is really important, and also simultaneously get those healthcare experiences where you've got more responsibility and a future medical school or nursing school or pharmacy school or dental school can see that you've had meaningful face-to-face patient activities. It could also be something like working on the electronic medical record or working in customer relations. It doesn't have to always be like, I worked in a traditional patient care setting. There's lots of ways to get involved. You can be in public health. But really getting the background to apply for those jobs is important. And again, UC Merced Extension does a great job with that. And we have a lot of time to talk more about that in the future. The other way to get really involved in the doing piece is research. And UC Merced absolutely stands out for its engagement of students in undergraduate students in research. So 77% of UC Merced students participate in research. That's one of the highest rates in the country. It's definitely the highest rate in the UC system. A lot of places you go, people are like, oh, sorry, yeah, there's like 20 other people who applied for this role in my lab. I can only take one. At UC Merced, it's just smaller. The professors have a lot of time for individual attention, for welcoming you into their lab or research community. So it's super exciting. It doesn't have to, some of it's foundational science. Of course, there's a microscope on the slide, but it could also be working in a community project or working in on a psychological study or working in preventive health, lots of different ways. And UROC is an amazing way to get involved, and it's really open for students to participate. There's a lot of summer stipends. So that's the undergraduate research opportunities engagement really hub for students. So the other things that are great about doing research is that you can also have an opportunity to present your work, to get a letter of recommendation, which you definitely will need in applying for a healthcare field. So, and some people just do the research and go, this is what I want to do. I want to get a PhD in research. So lots of ways, another way to explore different health options. And again, this is a real huge strength of UC Merced that you're not going to find at a lot of other places. So the third piece of this is applying, right? Applying to pre-health fields. And so that involves things like getting letters of recommendation, standardized testing, writing a personal statement, writing up your activities, and planning for an interview. Lots of great ways to get involved with this. We have a lot of skill in mentoring students through the application process, lots of application support, including the group. Remember, I mentioned at the beginning, the prime time, the medical students are really excited to mentor you in this, but so am I, and so is the rest of the team. Lots of opportunities for practicing interviews, how to write your CV through the Writing Center. There's a whole series of healthcare webinars, pre-health webinars that I run. And then along with Dr. Susan DeReamer, we also run some how to prepare for the MCAT webinars, again, mentorship, and then really we can dive in with the partnership of the Writing Center to writing your personal statement. So lots of opportunities to really present yourself well. And I will add that another unique feature of UC Merced is that our career mentoring does not end the day you graduate. I get that question a lot. We are excited to partner with you. We know that lots of times people take a gap year. You don't necessarily go immediately into your long-term career. We are excited to work with you at any time, even if you've already graduated and you're, taking a gap year to do something else. Come on back and find us. Happy to meet with you. Just met with a student like that this morning. So the last thing I have to say is, of course, thank you. I really want to give a shout out to our team that is here with us today, really supporting all that we do in, well, both admissions and in pre-health. And just let folks know that if you have questions, I'd be very happy to answer them. The main thing, though, is to really find your right fit. It's not a quick decision, but it's better to make a good decision than the quick decision. And we are here to help support you in making the best possible decision you can. I hope that's into healthcare, but it may be we need people in all fields, right? And so we're here to really help you find the way to be the best version of yourself and find a career that really feels like the right fit for you. So with that, I will stop sharing and see if there are questions.
Excellent job. Thank you so much for that fantastic presentation. And we definitely have questions coming in. Some of those we have been getting to behind the scenes as we promised. But let's go ahead and dive into some that we are getting live here. The first one I have, and I would like to ask, what are the best majors at UC Merced to get students prepared for medical school?
Um, well, I think I've already spilled the beans here by sharing the fact that I was an English major. I'm not sure that that is not the most common pathway to healthcare, but is a path. Most commonly, what you will see students major in, not just at UC Merced, but at many universities for pre-health would be biology, particularly human biology, molecular and cell biology are very popular majors. But I will say, and they're great, and there's a great opportunity to do research with that. I would say public health is also an extremely popular major, because it's going to give you the bigger view of healthcare. We certainly have had students major in chemistry, bioengineering. UC Merced is about to launch a neurosciences major that I suspect will be very popular. So there's a lot of science fields. Again, you can see my passion is humanities, but it's really all about finding the thing that you love, that you are passionate about, right? Find the thing that excites you. You should major in the thing that excites you, and then work with the major then work with the advisor to make sure, oh, these are the classes I need to take. Let's make sure that these two things fit together. There's a lot of people who end up really passionate about psychology and then work in the pre-med and pre-health requirements that way too. So it is a question of what is going to make you most excited to wake up in the morning and go to class and learn. That's really at the crux of this. And then parallel to that is, how can I synthesize that with the courses that I need to take?
Wonderful advice. The next question has to do with, what if a student is interested in nursing? What does the pre-health pathway look like for that group of students?
That's a great question. And of course, it depends, for starters, on what kind of nursing, right? Because there's so many different fields within nursing. There's a licensed vocational nurse, there's registered nurse, there's advanced practice nurses like nurse practitioners. So nursing is not a one size fits all field. There are a list of prerequisites. The early ones look the early ones. The ones that, are foundational actually look relatively similar to the pre-med requirements. I would encourage you to look them up and meet with one of the Bobcat advisors to be certain. I'm just going to use this as a moment to point out that not every medical school, nor every nursing school or pharmacy school or anything like that has the exact same requirements. So there's not like a universal for any of these fields. These are the absolute classes for this particular field. What you'll see is here's what's most commonly asked for by schools. Mostly it's going to be the science classes that I put up there, as well as a class on like writing and a class on communication and psychology. Those tend to overlap a lot, but you should definitely look up the specifics of the field that you're interested in. But the ones that I put up there for med school are fairly commonly seen. The other thing I'll say is that a lot of times you'll see anatomy listed, and while Merced does not have an anatomy course right this minute, we will be offering for the first time in a very long time an anatomy course taught this spring by Dr. Nrpendra Dhillon, who is an absolutely legendary anatomist. He actually came from UCSF. He taught anatomy for 3 decades or almost 3 decades at UCSF and other institutions, winning every teaching award there over and over again. We were so lucky to have him at UC Merced, and he's passionate about teaching anatomy. So that will be offered starting this spring and then every spring thereafter.
Fantastic. Thank you so much. Our next question coming in, how does UC Merced help prepare students for the MCAT?
So great question. Well, first of all, I run an entire webinar on this. Feel free to join me anytime. And Ricky, you can just tell me to stop talking on this one because I will go on way too long. But just to put it in a brief nutshell, for people who don't know, the MCAT is the preparation, the standardized exam, the aptitude test that one takes when applying to med school. It is a long 8-hour exam that covers 4 different areas of competence. And it includes things like scientific knowledge, but it also includes things like reasoning and reading comprehension. So it's a fairly, and behavioral and psychological sciences. So it's a fairly wide-ranging exam. UC Merced helps you prepare for the MCAT by the fact that the courses that we offer, first of all, meet the required material of what's covered in the MCAT, which is huge, but also that in those courses, you're going to, again, have smaller classes, more time to interact directly with the professors, more opportunities for tutoring, so that you're going to really learn the material well. When students ask me how to prepare in their first year, what I always say is, your first shot is the best shot. You'll hear that all the time in medicine. And what that means is really, really try to learn the material, do your best the first time when you're taking these courses, when you're taking your first year of biology and of chemistry. And then use your study for the MCAT as a refresher and not like, oh God, I have to learn everything because I, didn't learn it very well the first time around. So I would say the academics will support you well. The other thing we have that really supports students well is that there's a lot of opportunities for reinforcement of strong study habits. The average student will study for about 12-ish weeks or more, 12 to 14 weeks at least for the MCAT. And we're talking, 6 days a week, like serious. And so that is very helpful, having those good study habits. And then also, when you say MCAT, I think a lot of people think about using a commercial test prep that's very expensive. And our medical students that we work with have been really generous with their time in helping students realize that there are so many free and low-cost resources out there that you don't necessarily have to do super expensive test prep to be ready. In fact, that you might be better if you pursue some other avenue. In fact, it might likely be better if you pursue some other avenues. So they've been really helpful in mentoring our students around MCAT prep.
Perfect. Our next question, does doing undergrad at a UC help when applying to another UC for medical school?
Absolutely. I think there's let me put that differently. Every student is different. Your application will be different than somebody else's. So I'm not saying like, oh, if you don't go to a UC school, you'll never get into a UC med school. That's absolutely not true. We want to take students from a diversity of backgrounds and places for sure. But that said, when you do apply to a UC school, and they know where you went to undergraduate at a UC college of any university of any setting, they know the rigor, they know the curriculum. There's really no questions. Like that's a sure bet in terms of understanding what your background is. So I'm absolutely not saying that you couldn't get a great education at at Fresno State or at some other institution. I'm just saying that they do recognize and respect the rigor and the depth of a UC education.
Excellent. And now earlier you mentioned the pre-health mentorship. So we have someone asking does that also include aspects of dental?
So it's a great question. We are trying to build out all of our pre-health professions mentoring. So at the moment, and I will also say from experience that a lot of students who come in they feel very certain they want to do X, Y, and Z career path. And then there tends to be a lot of shuffling and changing as you get into the courses and the experience. You go, oh, I thought I went to do this, I did that. At this time, we are not able to necessarily particularly pair you with like, oh, I think I want to do pharmacy. Therefore, my mentoring group with 4 students will be with a pharmacist. Actually, that one we probably could. But mostly that's not because there's just too many healthcare careers for us to have. Remember, the mentors, their schedule has to match up with yours. So because of time availability, we put a group of 4 students with a healthcare professional. Honestly, it's based on the hours that people are free simultaneously. That tends to be the biggest driver. Um, and our experience thus far has been that health professionals do a great job of mentoring in any field because they understand the basics of, okay, you've got to take classes, it's a lot of work, we need to attend to our well-being and emotional health, think about work-life balance, think about getting experience outside of the classroom, volunteering. So there's a lot of commonalities, especially at the beginning. When you get further into it, then you can look for a place to volunteer, and that might be like specific to a dental clinic. And that's where, again, that's where we lean into trying to find community opportunities for our students rather than the mentoring phase. It's just, um, uh, there's a strong commonality. So I think it works, but we're not able to just sort of uniquely match. There, you saw the slide with a million healthcare careers. There's just too many options.
All right, cool. So the next question, will I need to take calculus or biology if I've already passed the AP exam with a 3 or better?
Great question. So partly this depends on what you're applying to. I'm going to talk about med school because that is what I know. So full disclosure, I am not trying to answer this question for like nursing school or pharmacy school, because I honestly would have to look up the answer. Um, uh, if you're applying to medical school, first of all, congratulations. If you've gotten a 3 or above on an AP exam, that's fabulous. Um, while that might be enough to meet the graduation requirements in your field, a med school is not going to look at a 3 on a calculus class that you took in college and say, ah, that's great. I'm sorry, in high school and say, oh, that really meets the requirement. They're going to say, ah, they came in with a strong calculus preparation. Why didn't they take another math class? So what they're going to want to see is a grade from something that you took in college. And I also know that this wasn't part of the question, but I'll answer it anyway. A lot of people are taking classes at community colleges. I mean, that's okay too, but anything that you did prior to matriculation in high school, in college, excuse me, prior to starting college, med schools are going to say it's hard to get into med school. They're going to say we want students who are really motivated. So great that you had that preparation. Let's see you take the next course. Like show me, demonstrate your motivation. So if you're applying to med school, I cannot urge you strongly enough that let's just say you had a 3 on a calculus class on the AP. You could either start UC Merced or really honestly any college and retake calculus and maybe have an easier time of it. Or if you've taken the AB and the BC exam, you could take a more advanced class like multivariable calculus or linear algebra. But I would really strongly urge you to repeat those classes at a university level to show your competence and skill in those areas because that's the med schools are going to be looking for that. It is very competitive to get into med school now.
Very good. Now, is biochemistry, is that a good major for medical school?
Absolutely. Again, you already heard me say it. I think you should major what you're passionate about. If you are passionate about biochemistry, then that absolutely should be your major. Lots of people are super passionate about biochemistry, my husband included. He was a biochemistry major and now he's an MD PhD and been practicing for years. If it is your passion, you should do it. It definitely will prepare you well for the MCATs. It'll prepare you well for med school. It'll prepare you well for nursing school. But if it's not your passion and your passion is something else, please don't major in anything just because you think it'll look good for med school. Again, you got to love going to school every day. And if biochemistry is your thing, then absolutely it's the right choice.
Perfect. Now, since the prime time application deadline has already passed, would it be beneficial to sign up for next year?
Absolutely, for sure, if you can. Yeah, that's a great idea. They do look at applications every year and on a rolling basis too. the med students are completely wonderful and dedicated and big-hearted, and they want you to succeed. They will help you, all the way through this process.
Wonderful. Next question. What is the difference between cognitive science and neuroscience majors? And is one better than the other for going into psychiatry?
Um, okay, so in terms of like what's the difference in courses, I would say you should probably that's like a let's look it up online. And honestly, I would talk to the Bobcat advisors or the major advisors in making that decision. Again, I'm going to go back to the same line, like find the thing that you are passionate about. Generally, neuroscience is going to have more in-depth sort of STEM classes, but cognitive science will too. It just will have, in addition, will have some more psychology courses. Do you have to major in either of those things to go into psychiatry? No, absolutely not. Remember that psychiatry is a field that you go into from medical school. You go to med school, and then when you pick a specialty, which is not until you start applying in your fourth year, um, you could pick psychiatry. That's great. When you're applying to residency programs, for the most part, it does not matter what you majored in college for a residency program. What they're going to care about is what you did in medical school. So again, I will say from the perspective of having advised med students, have been a career advisor for the past like 20-ish years. In my experience, I would say on the order of about 3/4 of people who go to med school end up thinking they want to do one specialty when they walk out in the door, and then they walk out the door wanting to do a totally different specialty. People change their mind. That's great. That means that you're learning about new things, you're exploring new things, and that's in medical school. That's not even like in college, right? That's when people are way further down their career path. So, for the person who's considering cognitive science versus neuroscience, I would look at the courses and say, do I want to take more things that are going to be, oriented towards neuroscience and physiology, or towards, cognition, which also includes psychology and behavior. Look at the different course lists, see what seems best for you, and then recognize that you're doing this for you. You're not doing this for just a career path, because your future, if you end up in med school, like they won't look back on what you did in college. They'll want to know what you did in med school. Your job in college, again, this is one of those, I can't say this strongly enough. If you're thinking of a healthcare career, your job in college is to figure out, do I really want to be a healthcare professional? Do I want to be a nurse? Do I want to be a pharmacist? Do I want to be a doctor? It is not to pick a medical specialty, or for that matter, a nursing specialty or something like that. Medical school, nursing school, all the other schools are designed to expose you to all those different specialties. You don't need to do it early. Don't miss the most important step, which is figuring out, where do I really fit? Do I want to be, again, a doctor, a nurse, a dentist, a vet? Like this is the questions I should be asking now.
Perfect. That kind of segues into the next question I'm seeing here. This person's writing in that they're interested in a health-related career, but they don't necessarily want to be a doctor or a nurse. So do we offer at UC Merced seminars, workshops, maybe the webinars that you mentioned on how to determine what exactly you want to do? You want to be in the health field, but what do you want to do?
Yes. Okay. So first of all, thank you for this question. I think this person's a plant in the audience. I'm so glad you're thinking this way, because you can tell my passion is like helping people find their fit, and it could be in lots of different things. The course that I mentioned early on, Introduction to Medical Learning, is a 1-unit course. It's run by the Department of Medical Education. So that's my department, and I work with our staff and our faculty to oversee it. It is very much designed to help people think about different healthcare careers, read about different healthcare careers, start their exploration process. There's so many opportunities out there. The explorecareers.org is really a good place to start looking at different things. And if you are thinking you don't know that you want to be a doctor or a nurse, I congratulate you on your bravery, your open-mindedness, your open-heartedness. That's exactly the kind of courage that you will need to make a good decision. So hang on to those thoughts.
Very good. And let's see, we are getting closer to wrapping up here. Let me go ahead and take a look and see what other questions we may have coming in here. Okay, well, this is actually a good one for us to kind of start tying things up just a little bit here. But just another reminder to everyone that is with us here tonight, if you haven't yet had your question answered, we're doing some of those behind the scenes, but also if you haven't asked your question yet, now is the great time to click on that Q&A button and send that in to us. But the next one I'll go ahead and ask you is, how is life as a family medicine doctor?
Wow, I'm getting real, thank you. I appreciate this question. Thank you for asking. Um, there has never been a more important time for primary care than right now. I think we are facing a lot of challenges in our world, a lot of stressors. We've just been through a pandemic. People are worried about global warming. There's always educational, financial challenges, housing challenges. I work in the refugee clinic, so we also have challenges of stress and immigration. Those challenges come in all sorts of ways for different communities and patients and people. And one of the things that you learn in family medicine is that diseases don't happen in textbooks, they happen in real people. And it is one thing to sort of learn, all the symptoms of a disease and all the lab tests and all the medicines, and it's a totally different thing to deal with real people. We're living in an age of AI, and so people are just like, well, can I just look my symptoms up online, or let me just ask AI what I have? My patients come in all the time, like certain that they know what they have. And the reason that AI will never replace, well, family physicians or any physicians is because we are humans. And the human interaction has never mattered more than it does now. That's what distinguishes us from just being a dispensary of medications, is someone who can really listen, hear, express empathy. My gosh, you're really going through a lot right now. Tell me more. Can listen, can know not just the individual, but also in many cases, like for me, I take care of extended families. I have a lot of 3 generations in my clinic where I take care of the grandparents, the parents, and the kids. I've had some of them go on to have more kids, and I've got like 4 generations. Uh, Understanding the big picture of someone's health is not just about knowing a bunch of symptoms or lab tests. It's about understanding who they are, how this illness or wellness feels in their body, how their family, how are they dealing with their family and their community. And it's all about being human. And I would actually say that for all parts of medicine right now, the best thing you can bring to medicine or healthcare is your humanity. Family medicine really highlights that humanity. It lets us build long-term relationships with patients. I've had a lot of patients in my clinic, in my practice for like 20 years, because I mentioned I work in the refugee clinic. So we see patients when they first come in, but we don't kick anybody out of the clinic. So if you want to keep coming, you keep coming. So here I am, 20 years into my practice. I have a lot of patients I've been seeing since I was a resident, along with their families and sometimes their new babies and their grandparents who come to visit and their extended family. You're probably wondering why, if I'm working at UC Merced, I'm still seeing patients at San Francisco General. And the reason is those relationships matter. After 20 years, I could not abandon my patients. I couldn't just, you don't just walk out of that relationship. My patients come in and they say, Doctor, you are my family. They hug me, they kiss me, they bring me, they bless me, they bring me food from their country. And it's not about the gift or the this or the that. It's about the relationship. And those relationships are priceless. So it's never been a better time to be a family doctor or really just a compassionate healthcare professional in any field.
That sounds so incredible and so inspiring. So we actually have another question, and this might go a little bit again in what you just now mentioned. So this one's coming in and they're asking, what is your experience in medical school, including your residency, your fellowship? How long did that take you?
For me, let's see, I did 4 years. So I went to UCSF. I did 4 years of medical school at UCSF. I took a year between third and fourth year to do a master's in public health at Berkeley, which is actually pretty common just because I wanted a wider perspective on healthcare. I was interested in healthcare in under-resourced communities, and it provided great background. Um, while I was there, I TA'd, honestly, I TA'd Bio 1A just to make money and as a student, and I discovered that I loved classroom teaching, so education became part of my passion. I spent the next 3 years as a resident at San Francisco General in family medicine. And then I did a 1 year fellowship in medical education. And so I've practiced ever since. And my practice has been defined by two distinct features, and I love both of them. One is patient care, which I just talked about. The other is education. So educating students to meet the needs of their patients, particularly patients from all sorts of backgrounds with different healthcare needs in a way that emphasizes compassion and humanity. And so that's what I was doing for quite some time at UCSF until I got recruited again, as I mentioned, for my dream job, which is to be here at UC Merced.
Amazing. Well, I'll go ahead and give you a moment here. If there's any last words that you would like to offer, that maybe either questions that haven't come in that you'd like to share some information, or just words of encouragement.
I think my words of encouragement are follow your heart. And that is not always that easy to do. I think it's easy to let your head override your heart sometimes of what you think you should do, of what the world wants you to do, what the right thing is to do. And that might or might not be the right way for you. I would say look outward first, gather lots of information. That's the exploring part. Go visit lots of healthcare sites. It's not easy to do. I recognize that. But take the opportunities that you're given, explore, including at UC Merced, get information, and then tune out all that outside information and look inward and ask yourself, I've worked so hard to be where I am. It's me that gets to go to work every day. Do I like to work with my hands? Do I like to talk to people? Do I like to look at sheets of data? And make the best decision for yourself. And then here's the key part. Don't stop thinking about that decision. The decision you make the first day might be the right one, but it's also possible that you may pivot your path, and you've got to be open to that with a full heart. We are here to help, and we are here to be your partner. So don't be afraid to ask for help. And I really think that in the end, it's all about community and finding human connections, both when you're a student in education. Part of opening those doors is every time you go to talk to a professor, you're creating relationships. When you work with your peers here, that creates relationships. Your family support you with relationships. You're going to also build relationships in the future. So be open to building those relationships while you're at a university, which is hopefully going to be UC Merced, but wherever you are in your future healthcare career with your future patients, because it's those relationships that really sustain us. And it's what makes it worthwhile. Thanks.
Fantastic. Thank you so, so much, Dr. Venner. It's been such a pleasure here and lovely meeting you. This was our first time meeting, so thank you so much for taking time out of your night as well. I know our entire audience learned so much tonight. And as we do start to close out, I want to remind everyone, make sure that you open up your chat box. We have been sending you a bunch of links, so you want to start clicking on those now. A couple of things that I'd like to remind you of, and these are also over in the chat area. Tonight, we have been recording this event, so it will be made available on the admissions page. So that for admitted students on the events page, you will find that link there in just a couple of days. Now, if you've attended other events and you'd like to watch those back as well, all of those links are available there in the same place. And of course, we also have some additional webinars that are still upcoming for the month of April, so you can also find those registration links there as well. Now, the other thing you're going to see on that admitted events page, it's going to tell you about all of the in-person events that we have coming up, including the Admissions Roadshow. That means that we have recruiters and other staff members from the admissions office coming to a city and region near you. So we pack everything up, we come to those regions, and then we're a little bit closer for you. So you can come out and meet us, hear some keynote speakers, meet so many of us there. So we definitely hope that you hop over to that page, find a region that's close to you, and go ahead and get registered. We have a few of those coming up in April. Now, we also have a few other events, but the biggest one of the spring term is Bobcat Day. Make sure that you jot down and you take a look at the website. It is Saturday, April the 19th from 8 a.m. to 2 p.m. It is like Disneyland at UC Merced. We will have balloons there. We will have dancers, our dance team, our cheer team, the band will be there, karate team. We have over 200 tabling events with clubs and organizations. There are presentations from every single one of our schools that are there, so you'll get to kind of get a test run at some of these, meet faculty members, get your financial aid questions answered. All of us will be there walking around, and you may even get a chance to take a selfie with Rufus Bobcat himself. So make sure that you mark your calendar, get yourself registered for Bobcat Day. As I said, it's the biggest event that we offer in the spring term, and we can't wait to meet you. A couple other things are on that page, so go ahead and bookmark that and get over there so that you can get registered. Another one that is coming up is Experience UC Merced, and that is going through the month of April. That is also a special event. You can get registered for that. You'll have an opportunity for a campus tour. You'll also get to sign up for your choice of lecture. So you can go and actually kind of pretend like you're a real Bobcat, that you've already accepted your SIR and you're already coming here and kind of get a sneak peek. So firsthand experience in a real classroom lecture, and also grab a bite to eat while you are here and just overall take in the ambiance that we are here at UC Merced. So thank you once again for joining us tonight. If we didn't get to your question, just know that we do have contact information over in that chat area, so you can reach out to us if you want a follow-up or just have something else that came to mind here in the last few minutes. We definitely hope to meet you very soon in person or on another virtual event. My name is Ricky Hill, your e-recruiter. Hope to see you again very soon. Have a great night, everyone.